Hello, folks. Representative John Lee here. I am at the Brockmann campus. It is an amazing facility that your state government spent a little under $80 million to build for mental health treatment. And the Brockmann family donated sold some land for the state to build this facility, and so they named it after the Brockmann family. But this is an amazing 48-bed facility, 3 separate wings, 16 beds per facility for treating people in mental health crisis. It was designed originally as a residential facility that can handle people long-term. They live here. Each of the rooms can be locked to keep people safe inside. There's facilities for staff. It is amazing and phenomenal, but the sad thing, as I've reported to you before, is that it is not open. The state is spending $600,000 every 2 years to keep it in a closed, quote-unquote, warm status. Well, we just had a meeting today with people from Health and Human Services and several legislators from around the state. We're either here in person or online to discuss where are we going. Bottom line is, Health and Human Services is conducting a series of 4 community outreach meetings. They had one with citizens here in Clark County in Southwest Washington a month or so ago. This was with legislators. And bottom line, they're going to compile a report, give it to the head of Health and Human Services, who will then present a budget to the governor. And then the legislature begins its deliberations on where do we find the money to potentially get this open. Short answer, made by many, many different people today, there's not enough money to hire the staff to get this open through 2029 and potentially several years beyond. So what I want to see, and as we all know, the need is absolutely huge for treatment, and that means facilities to get open, whether they are people living there semi-full-time or if it can be in and out patient. We just need more facilities open to care for those in a mental health crisis in our community. And so I am advocating for, and was able to present, we need to consider, strongly consider, a public-private partnership where we lease this facility to a mental health provider that can come in. They already have the staff, they have the training and the certification to use this facility and open the doors so that people can come here and get the care that they need. And that's what I'm focusing on. I had friends, Carolyn Eslick, representative who's just amazing in this. We had Representative Nicole Macri from the Seattle area came down. She heads the committee on this. So there were some good discussions. It's moving slower than I would like to see. We've been having behind the scenes discussions like this for 11 months, but we are trying to nudge, to encourage, to genuinely chide the people. What can we do to move the ball forward to get this open? Because that's what we need. This is, again, roughly an $80 million investment of your tax dollars. They've got 3 wings, 16 beds per wing, and we just need to get them open. With the 3 wings, there's amazing opportunity for flexibility, that they could treat patients with different levels of need, different security requirements and whatnot. It's an amazing facility. And so I am fighting for you and our community to do what we can to get this open sooner rather than later. As always, it's a privilege to represent you. As always, you can reach out anytime. I'm happy to meet you, hear your concerns, and I am here to serve you.